Can someone hit the recording button?
I did.
Perfect, thank you.
Yeah, we've been recording. Sorry, it took me a long time to run up.
I'd like to call the October 5th, 2020 Health Committee meeting to order. We have 5 members present. Member Martin is absent, and Member Metzger is in room 404. We have minutes to approve from August 18th and August 31st. Have a motion? Motion by Chung, second by Gordon. Is there any additions or corrections or discussion? If none, could you please call the roll, Ms. Morlock? And I will vote.
Thank you. Member Gordon.
Yes.
Member Chung.
Yes.
Member Witt. Member Witt.
Oh, yes.
Thank you. Member Metzger.
Yes.
Thank you. Chairman Schaefer.
Yes. Do we have any members of the public?
Chairman, we do not have any members of the public or emailed public comment this evening.
Thank you. So then we'll move on to departmental matters. First up is Jessica McKnight, Health Department Administrator. Hey there. You have some items for action. The first one is request approval of an ordinance of the McLean County Board amending the 2020 combined annual appropriation and budget ordinance from 107 for the Health Department. Is there a motion? Motion by Metzger, second by Chung. Would you like to talk about this? It's on pages 4 through 6 for your packet.
So this is a request to amend our budget to allow us to use our CURE funding, which comes through the CARES Act, to stand up a call center and also to pay for the overtime of our staff that are responding to COVID-19. And so that is, again, using money from the CURE fund, so through the CARES Act.
Okay, is there any questions? Member Metzger.
You're setting up a call center, and this is going to be something that would be through a vendor organization. So if you need to shut it down, then that can happen. I'm not saying that we would, but at some point, if we weren't getting the calls and the issues that we are currently getting, you could move back on that decision. Is that correct?
Yeah, so we're working with county administration and county information technology to stand this up. So it's really still very much in the planning, but at least getting us through the end of fiscal year 20 is the plan right now.
And then this will also aid with mass vaccination calls that we probably will get eventually sometime next year. Anybody else have any questions? If none, I guess we'll take a vote. Ms. Morlock, and I will vote.
Thank you. Member Gordon.
Yes.
Member Chung.
Yes.
Member Went.
Yes.
Member oh, he's not here. Member Metzger.
Yes.
Chairman Schaefer.
Yes. Okay, the next is a request approval of a resolution amending the funded full-time equivalent positions resolution for 2020 Fund 112 Health Department 0061. Is there a motion? Motion by Chung, second by Metzger. I'd like to explain this one. This is on page 7 and 8 of our packet.
So this is a request to amend our FTE to add 1 FTE for a communicable disease coordinator. It's reinstating a position that was previously eliminated about maybe a year and a half, 2 years ago, but specifically looking for this position to help with COVID-19 and working with our higher education institutes and schools and possibly long-term cares, but mainly focused on outbreaks. So really something that's needed to specifically be that point of contact for those individuals.
Any questions? Okay, Member Chung.
Thank you, Madam Chair. I was just wondering, I guess, what's your timeline of trying to hire somebody for this? It's been needed for almost a couple months now, so I'm hoping that we can get somebody on board as quickly as possible. Thank you.
So yeah, the positions are posted. So the position's posted, and we're just hoping that as soon as we can get the approval through county board, then that we would move forward. So, end of October is when we want to start. If not already interviewing at that time, then be able to even extend an offer at that time.
Member Gordon?
Thank you, Madam Chairman. Do I understand correctly that this is a second communicable disease supervisor?
So this is a communicable disease coordinator. So above that position is the communicable disease supervisor.
Thank you.
Any other questions? If not, Ms. Morlock, and I think on all of these, the chair will vote, so.
Member Gordon,
Yes.
Member Chung,
Yes.
Member Went,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. Motion passes. And the last one is request approval of an ordinance of McLean County Board amending the 2020 combined annual appropriation and budget ordinance for Fund 112 for the Health Department, and that's on page 9. And this is the pay for that position for the end of the year, through the end of the year, correct?
Correct.
Is there a motion? Motion by Chung, second by Metzger. Any questions? Okay, hearing none. Ms. Morlock?
Member Gordon,
Yes.
Member Chung,
Yes.
Member Went,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. Okay, then you have your report. Is there anything you'd like to highlight?
I guess highlighting where we are with contact tracing personnel. We have hired 29 contact tracers, so those are new personnel brought on. And I think 5 to 7 of those right now are even working in case investigation. So they've been cross-trained to help out with that. That's really where our need was for case investigation, to talk to the individuals who've tested positive so that we can identify contacts to then turn over to the contact tracers. We've done interviews in the last, probably I think it was last week, to bring on the final 10 to bring us up to, I think, 40. So 10 or 11 in this last bunch. And the plan is really, again, to bring them on in 2 small groups. We just found that training, it works best in groups of about 5 to 6. So by the end of October, to have 40 contact tracers in place. It's been kind of a little bit of a slower period, so we're using that to regroup, replan, and be ready for another surge this winter.
Are you expecting another surge?
Yes, with flu season, holidays, definitely. So, COVID's still out there. We're still seeing, at least 10 cases a day, it seems like. So, I anticipate that as people get together over the holidays, especially, that we'll see our numbers go up this winter. So if they don't, that'll be great. That'll be a blessing, but we're prepared for them to increase.
Any questions from the committee? Member Gordon?
Member Metzger had her hand up too, and I've already asked one. Oh,
It's okay.
all right. I wanted to ask Ms. McKnight, it has seemed to me, watching the numbers, that the county generally is doing better in terms of new cases, considerably better when compared to the worst spikes. is that making it easier for contact tracing at this point? And
Yes.
is there some, are we also, as a separate question, are we also seeing, from your vantage point, are we also seeing greater use of both mask wearing and social distancing?
I don't know about the second question, but the first question, yes. We're definitely seeing the ability to catch up, if you will, with contact tracing. And like I mentioned, cross-training our contact tracers to do case investigation as well, which is just helping us. So we're using this time period to do that, to be prepared for another surge. But, you know, I just anecdotally, I see a lot of individuals wearing their face coverings out in public, which is reassuring. And there will obviously still be those situations where people do not. But, you know, I'm hopeful that we as a community are still taking this seriously.
Can I follow that up with one more question, Madam Chairman? Thank you. I haven't seen as much specifically about particularly Illinois State. The impression that I have, and that's all it is that ISU is doing better as well. I hope that's right.
You know, obviously their numbers are definitely down. Their new case numbers, their positivity is down. You know, we as a county have seen a slight decrease in our testing overall. So about a month ago, we were doing a lot of testing. So we've seen that dip a little bit, but we also have seen our cumulative positivity rate stay about the same, which is a good thing. So showing us that we're still doing a lot of testing, especially comparative to counties of our size. But that's something that we hope that we continue to see as people that are taking advantage of testing, getting tested if they need to. So I don't know necessarily if I would say that they're doing better. We know that their numbers have decreased, their positivity rate has decreased as well.
Thank you very much.
Member Metzger, did you have a question?
Yes, I do. I have a question related to the software. We have a rollout of number 3 of Salesforce, which is a software organization out of Indianapolis. And apparently the IDPH established that. Is that correct? Mm-hmm. So I just know that from the part of our organization where I work, and quite an expensive endeavor. So how is that impacting our bottom line? Because I'm assuming they're forcing us to use Salesforce.
Yeah. So currently we're using it and there is no cost. So we don't really know future-wise if this is going to be the system that they're going to require us to use. But as of right now, the Illinois Department of Public Health is funding that.
I kind of go back to some of the things that Member Gordon mentioned. ISU is supposed to be doing like surveillance testing, but are they really getting their numbers that they are trying to hit on how many students are getting tested? Because I kind of got the impression that a lot of students weren't getting tested, and that's kind of the way they're avoiding having to figure out whether or not they were positive or not. And so I guess with the contact tracers that you have there, if they've heard anything like that, or you know, that kind of avoidance kind of thing.
Haven't really heard much about that necessarily, specifically about avoidance, but you know, obviously we've seen the numbers decrease, but you know, we still have individuals that if they're not getting tested on campus, they may be going elsewhere for testing, because there is testing available multiple places in the county. I know talking with ISU about testing, and they have plans to increase that. So they're taking several measures to try to increase and encourage students to get tested more often.
Member Chung.
Thank you, Madam Chair. I guess going back to this, because the ISU numbers is something that I've really kind of been keeping an eye on quite a bit, especially when we spiked a month ago. Right now, I just looked that in the last 7 days, they've given 1,058 tests, and they have the capacity to give about 1,500. So they're not, like Member Schaefer was kind of saying, that they're not really hitting these numbers. To me, frankly, it's a little concerning to me, especially when I was kind of tracing and looking at the numbers every day and seeing that maybe they were giving out 200 tests a day. And to me, it seems kind of unacceptable for a student body of 2,000 and to have only give 200 tests a day. I guess I don't know what we can do more to kind of encourage people to get tested. Or I know that they said they were going to try and do mandatory testing, but now it sounds like that's been rolled back a bit or kind of not as big of a priority now. But to me, I'm honestly really concerned about these numbers not really telling the whole story. Especially since we really spiked. And then, in the last couple of weeks now, our hospitalizations were kind of at a high number, higher than we'd had been in months, because I guess this is the way these kind of waves go. So I don't know, I guess I'm just saying how I feel right now. I'm not sure if these numbers are really telling the whole story right now. And sure, if you just look at like saying, okay, well, our positivity number is down, but when not very many students are getting tested, I'm not sure how much there is to this. So thank you.
Do you expect an increase in when the schools go back in person, the K through 12 schools go back in person? Are you expecting that too?
Possibly. I mean, whenever the other schools in the county did go back, we did see an increase in testing. So there's a possibility, because of the parameters that IDPH has in place for exclusions, negative test being one of those things that can get a kiddo back in school. So there's a possibility that we'll see an increase with just more kids being back in school.
Member Chung?
Thank you again. I guess about I was going to ask a question about the elementary, the K through 12 schools going back, because I actually am a mother of two children who are in area of McLean County schools, public schools here. So this really does directly affect us. And I'm just wondering if the school districts have reached out to the health department and giving any sort of guidance. I've spoken with quite a number of parents who are concerned about going back. And, honestly, like I'd heard some anecdotal sort of stories that custodians weren't even made aware that students were going back until like 2 days after it was announced. And they're the ones who are supposed to be sanitizing and cleaning the schools. And that really gives me great pause and concern. So I was just wondering if the health department has been in touch. I'm just wondering because, we're all about a sudden having a great number of kids coming into contact with each other every day here within the next month or so. So I was just wondering if you can provide any information on that.
We've been having a call with our schools every other week since about the end of July, just gearing up. And really, that was about the time that Illinois Department of Public Health and Illinois State Board of Education put out their joint guidance. So we started having calls right before they did that, and then gearing up to when a lot of the schools went back into session. So I mean, there's a lot of individual needs of each district. So it's hard. There's no hard and fast. This is the threshold of an individual school where they should have in person, shouldn't have. So we're definitely talking with them individually about what their situations are, what their needs are. A lot of communication with our schools.
Member Metzger.
I just want to thank the health department for reaching out to the rural areas. And I know that, Colfax is in my district. The other two, Leroy and Hayworth, are in Mr. Martin's, or excuse me, Mr. and have testing done. So having it done locally, I wanted to commend you and thank you for that.
Any other questions for Ms. McKnight? Okay, thank you. Next up, we have adult and juvenile detention. We have Jason. And is Suzanne Scott also from adult detention?
Actually, Chairman Schaefer, I have the newly hired Suzanne Scott, registered nurse, BSN. And I will, if now that I have the floor, I'm sorry I didn't ask permission to briefly introduce Suzanne. She has taken on the leadership role at Jail Medical. She has longevity with McLean County government, so it was a promotion, and we're so excited that she is joining our leadership team. We had an interview panel that included some of Sheriff Sandage's staff as well. So I think that it was a joint effort to work together to have Suzanne join county administration and jail medical. And so I will step away. She's prepared to do her report on the adult portion of the detention facility, but I just wanted to take this opportunity to introduce her. Thank you.
Thank you. So then why don't we just start out with Suzanne, and she can give us a little background about herself, and then whatever she wants to talk about on the adult side.
Well, thank you. I'm happy to be here. I have worked here since 2005. I recently went back to school for my RN, and most recently my BSN. So hopefully my master's degree is in the future. I'm relatively new to the numbers side of things, but it looks to me, comparing the July numbers to the August numbers, that things have remained fairly consistent.
Okay, thank you. Jason, do you have anything you want to point out?
Yes, on page 1 in the third section under staff nurse, we did add coronavirus testing. We did our first test and it came up negative. That young person was released the next day, so the results were passed on to his home county, and we will be adding that in every month now as we see fit to do those. Other than that, numbers, a lot of kids in and out, but numbers are pretty much the same.
Okay, thank you. Questions for either Suzanne or Jason? I have a question on the COVID in the jail. Is there any positive cases in the jail?
No, there's not.
Okay. Anybody else have any questions? Okay, thank you very much. And next is Terry Edens, the nursing home administrator. And she's here. Okay. You have 2 items for action. First one is request approval of emergency appropriation ordinance amending the McLean County fiscal year 2020 combined annual appropriation and budget ordinance for the nursing home fund 0401, the electrical and the sprinkler systems. Is there a motion? Motion by Metzger, second by Chung. This is what we approved to go to property last month to do that life safety work from CMS. Did you want to have you have anything to say about that, Ms. Edens?
No, sorry, I'm getting laryngitis. We are currently waiting for them to get the contract out so that we could get it signed, and they're anxious to get started. So once we get that, we'll move forward.
Thank you. Does anyone else have any questions about that? If not, Ms. Morlock, please call the roll.
Member Gordon,
Yes.
Member Chung,
Yes.
Member Went,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. The next item is request approval of emergency appropriation ordinance amending the McLean County fiscal year 2020 combined annual appropriation and budget ordinance for the nursing home fund 0401 for kitchen carts. Is there a motion? Motion by Gordon, second by Metzger. Do you want to explain this one, Ms. Edens?
Yes, this is for, because of COVID, IDPH is recommending that we feed all of our residents in their rooms. And in order to do that efficiently and safely for sanitation purposes, we need enclosed carts, and we do not have those currently. Well, we have one. We need two more to be able to do the whole building correctly.
Any questions? Okay, Ms. Morlock?
Member Gordon,
Yes.
Member Went,
Yes.
Member Chung,
Yes.
Member Martin. Oh, I'm sorry, is he absent? Member Metzger,
Yes.
Chairman Schaefer.
Yes. And you also have your monthly report. Is there anything that you would like to highlight?
I just want to highlight the COVID results. We're doing very well, knock on wood. As of Wednesday, we possibly get back to visits next week. We will plan those indoor visits in an area where they cannot go through the whole building, but at least the residents will get to see their family members at the end rooms because they're getting pretty lonely. So I'm really proud of the staff for keeping COVID out of here. So looking forward to that.
Any questions? Okay, thank you very much.
She had a question, I think.
I don't have a question. This is Catherine. I just wanted to commend the nursing home because I know how difficult it is to manage the number of staff coming in and out. And it is amazing. And you need to thank your staff for the effort and yourself for the effort that you have made to keep those residents safe. And so I just want to acknowledge the efforts that you're making. So thank you.
Well, thank you very much. I appreciate that.
Anyone else? Okay, thank you. Hope you get your voice back. Next is the county administrator who has some items for action.
Thank you, Chairman Schaefer. If I may, under item D1A, request approval of critical hire requests on page 38 of your packet.
Is there a motion? Motion by Gordon, second by Chung. Questions? Hearing none, then Ms. Morlock.
Member Gordon,
Yes.
Member Chung,
Yes.
Member Went,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes.
Thank you. Before I move on and read the next action item, if I may humbly request of you, Chairman Schaefer, and of the committee, if it pleases the committee, because we have to do a roll call vote, we're suggesting that we do a motion for all of the items under D, B 1 through 8. And then if the membership would have an issue or concern and want to pull out one of the fund accounts for a later date, for example, for the meeting later in October, we just would humbly recommend that to be more efficient than trying to do roll call vote on all of those items. So if it pleases the committee, we would love to make that, have that strategy for this part of the agenda.
I agree, and I probably think everybody else will agree with that. Just kind of nod your heads and we'll go that route.
I think Julie especially would be happy with that. What I will do is I will read D1B, request approval of the Health Department's 0061 fiscal year 2021 recommended budget, including items 1 through 8, including all of the sub-departments under 8, found on pages 39 through 92 of your packet.
Can I have a motion? Motion by Chung, second by Metzger. I think maybe we should page through these individually by fund, just to, if there's any questions by fund, and then we'll take the vote at the end. Does that sound?
Absolutely, and I think that, I'm sorry, Chairman Schaefer, I apologize. I can have Health Department Administrator McKnight come back up to the podium to lead that discussion.
Okay. So it would be starting on page 39 of our packet. Unless you're looking at the big budget book, and I didn't bring my big budget book to where I'm sitting right now, so I don't know what page it's on in the big budget book. So
It's
The
222.
the first fund is 102, the dental sealant grant. Are there any questions or concerns on that? Member Gordon?
Thank you, Madam Chairman. I will advise in advance, like other members of the committee, I'm sure I will have questions on an item here, an item there. None of them is particularly pressing, maybe with 2 exceptions. So I want to sign on with that. With that, it's not a caveat; it's the opposite of a caveat. On page 40 in our packet, under this is the dental sealant grant. Line 62, I guess it's line 622.0001, medical nursing and supplies. I noticed that there is a significant reduction from the 2020 amended budget to the approved amount in 2021, and the size of that reduction, the dollar amount is minimal, but the proportionate size of that amount caught my attention. I was just curious about it. Have I directed you to where I'm talking about? Okay, thank you.
So,
Page 40, the last line.
so 0622.20002 dental supplies. Maybe that it's in that area instead. That's dental supplies. So we have actually increased that line item.
Okay, thank you.
Member Metzger?
I just saw that there was, and I'm not sure how that gets reflected. I believe that the county health department got grant money for dental, and maybe that doesn't fall under the sealant, but where does that get reflected in this budget, or does it?
And it's my understanding that it's through the CARES Act. So it would be in fiscal year 20, but I can definitely check on that.
Okay, thank you.
Any other questions on dental sealant on 102? If not, we'll move on to 103, which is WIC. And that starts on page 43 of your packet. Any questions on this fund? Okay. We'll just move on to 105 then. It should have received an email with some adjustments to this budget on the 067. And so I hope you all received that and made note of those adjustments. So do we have to make sure that we note that those were adjusted?
105 adjustments.
And actually read in the numbers that are correct?
Yes.
Member Schaefer, yes, we could read or Chairman Schaefer, I'm sorry, we could read those in, and then obviously the packet will be updated as such to reflect the changes made to those.
So just read the line items.
Yes, ma'am.
So under revenue 04070061, a new amount is 45,518. And then expenses adjustment for 05030001 to 31,186. Then under fringe benefits adjustments to 05990001 to 2,685. 05990002 to 5,563. And 05990003 to 2,386. Supplies adjusted 06120001 to 0. 06120003 to 1,500. And 06200001 to 50. On page 48. 06290001 to 240. And 06290001 to 0. Under services 07010001 to 317. 07180001 to 200. 07500004 to 200. 07730001 to 96. And 07930001 to 125.
Member Gordon.
Thank you, Madam Chairman. I hope that, I think this is correct. What Administrator McKnight just went over includes numbers where all of the percentages in the far right column read 100, and I don't think they should. So I hope that those percentages will also be adjusted in the update as the budget goes forward.
Yes, will be adjusted.
Okay, thank you very much.
You want to answer? Yeah.
Okay. Any questions on 105 with the adjustments? Okay, moving on to 106, which is family case management. Any questions on this fund? Member Gordon.
Thank you, Madam Chairman. I was noticing some fairly significant boosts in revenue under 0061, subdepartment 0062. The federal portion only of the high-risk infant follow-up grant and the state portion of the Better Birth Outcomes. Did we expect those kinds of revenue boosts?
So there have been changes to, I believe, one of the funding sources for these. The high-risk infant follow-up, which is the 04040042, actually did see an increase from the previous year. Again, the funding sources have changed, and they looked at our caseloads, and we did see an increase in our budget amount.
Thank you.
Anyone else have any other questions? Or did you have another question, Member Gordon?
Over on page 50 of our packet, I was noticing just a fairly substantial proportionate jump in the budgeted amount for 0612.0003, education materials and supplies. In 2020, the amended budget was 4,800. The actual amount so far is upwards of 6,600, and that would certainly merit an increase in the proposed amount. But I was interested in it going all the way to 10,000.
Yes, yep. So this is the budget for our car seats that we give out to our family case participants. So they're $79 a piece, and so we've budgeted to give this many out and just included that in the budget for next year. It's a program that's been going on since April of 2019, and I think that first year we gave out 119 safety seats.
Thank you.
It's a good program. Anybody else have any questions on 106? Member Gordon, that's okay.
I'm not anybody else, but on the next page in our packet, budget line 70706.0004. First of all, I'm unfamiliar with the initials RUM, and I apologize for not knowing what that is.
Rent, utilities, and maintenance.
Got it. On that line, it looked to me again like there was a fairly substantial, well, it is a fairly substantial jump in the proposed expenditures. Are there new contracts? Are there contracts being added for other services that we haven't been providing up to this point?
So this is to include the costs, our costs for the elevator in 200 Front Street.
Okay. Okay. Thank you.
New elevator.
Yes. All right. Thank you very much.
They work well.
They work.
I used it today, so I know that it works well. Any other questions on 106? If not, we'll move on to 107. And we have an adjustment on 107. And I think that if instead of going through every single thing with all the different ads and stuff like that on that, if we just do that one, the first line item that includes the revenue line, and then just know that it's going to be percolated down with all the different adjustments that we did with the budget amendment that we already have approved.
Did we skip 61? Did we skip 10761?
Oh, okay. Well, that's in 62. Okay. Sorry. Yes, we skipped 10761.
Yeah.
We'll do that one first. That's West Nile. Any questions on that one? Okay, hearing none, we will move on to 107-0062. Really 107-0061-0062. But and that's where I was talking in that 404-0018 line. If we just make that adjustment and then know it'll get percolated down to that.
So this is a line item for the contact tracing federal funding. So it was adjusted $1,445,426 of revenue.
Any questions about 0062? This is where most of the monies are going for COVID. And Is this where if next year we get any vaccine money or anything like that, anything to support that, would that also then go into this fund?
Likely, yes, yeah.
Just want to make that clear for everybody. Member Chung.
Thank you. I guess one thing, I know that you, Ms. McKnight, that you were talking about how many of your employees are all doing overtime and people are, it's like all hands on deck in terms of COVID and contact tracing and everything. So one thing I did notice, the overtime pay that was of course significantly higher because of everything that's been happening this year, but it hasn't been budgeted for any more. I guess I was just wondering if, I'm assuming that we're probably anticipating some overtime, but I guess I'm just wondering why it's not budgeted for more people for overtime there.
Yeah, it is not currently budgeted in here, but it's something we can take a look at. And the contact tracing contract that we have through Illinois Department of Public Health, we'll be doing a grant amendment here probably the next month or so, because half of the funds are through the CARES Act, meaning they have to be spent by the end of this year, and then 50% is going to be in fiscal year 21. So I already know that there's quite a bit of things that we'll be looking at adjusting for what we plan to do, and so that's one I can definitely take a look at.
Member Gordon.
Thank you, Madam Chairman. The update having to do with Fund 107, Subdepartment 0062, we had a 5-page update that came to us. And here again, this is arithmetic, but it's for accuracy. Again, in the calculated column, the last one on the far right, I'm seeing numbers, all of them are 100, and it seems to me that they shouldn't be that. And I hope that, again, that there will be a good look taken and just running the calculations so that that's updated and corrected.
Yeah, so Assistant County Administrator, Ms. Dreyer, she just mentioned that it's a formula error, so it will be corrected.
All right, thank you. Those errors can happen regularly. I know I've committed a number over the life of my career, so including time on the county board. So I appreciate attention to that and the corrections made. Thanks.
Any other questions on 107 0062? Yep. Next is 109, which is just the FCP money. Anybody have any questions on this one? This is one that we are not expecting any federal financial participation because they adjusted rates differently and put that money elsewhere. So it's not coming back the way it has been in the past. So that's why there's all zeros in that fund. Any questions? Nope. Okay, then we will move on to 110, which is developmental disabilities. And that is just basically property tax, and it funds the 377 board. Any questions? Okay, we will move on. And to 112, which has all the little letters with it. On number 8. So the first one is 112-0061-0060, which is mental health. Any questions on that? Okay. next is 00610061, which is environmental health. Any questions here? One of the things I'd like to point out on this is that the Board of Health, I believe it's on the geothermal fees, had an automatic 3% increase in their fees in escalating clause. And the Board of Health chose to not do that and not increase those fees to 3%. And food fees were also not increased this year because of COVID. And so basically those fees, the Board of Health chose not to increase those fees. Member Gordon.
Madam Chairman, I apologize. I did have a question back in mental health, subdepartment 0060. I lost track of my page here in my packet. I was looking for something in the updates. On page 62 of our packet, I had a couple of questions relating to 0503.0001 and 0599.0002, full-time employee salary and then employee medical and life insurance. Both of those showed a pretty hefty increase, and I was just curious as to what lies behind those numbers.
So we did add one FTE earlier this year, a behavioral health specialist who's working mainly in the community and with our trauma-informed care program.
And that would explain both increases.
Yeah, we approved that several months ago.
Okay. Thank you. I appreciate that. And thank you, Madam Chairman, for letting me double back just for a moment. Thanks.
No problem. Go back to 00610061. Are there any comments about that other than the fees comments that I made? If not, we will move on to 11200610062, which is on page 70 of our packet. Any questions on this budget? And these budgets are pretty much flat from last year and just using last year's numbers and not really increasing much of anything other than what has to be. Okay, we will then move on to 610063, which runs on page 74. Any questions there? Okay. Then we'll move on to 00610064 immunization. Questions? Comments? Okay. We'll move on to 00610067 health promotion. Also had an adjustment from the 105. This one was also adjusted. I believe on page 82, 400 line. Is that correct?
Yes.
And that was adjusted to be 32,353. Is that correct?
Yes, so 0400.
And then the salary got changed then too?
Yes.
To 246.
Yeah, medical and life insurance.
Yeah. Okay, the salary was to 246,425. And then the adjusted insurance number. Okay. Any questions on that adjustment? Member Gordon?
Not a question, just pointing out that 100% epidemic in the far right-hand column has happened again. Excuse me, I should not use the word epidemic. Those 100% figures should be corrected, and I'm sure they will be, and I thank you. And I didn't mean to be funny about pointing out my use of the word epidemic. Believe me, it's not funny.
Okay. Any other questions or comments on 00610067? Okay. Then moving on to 00610069 problem solving courts. This is the same funding they've had for the last, I don't know how many years. Any questions? If not, we'll move on to 00610096 community outreach. Any questions on that? Member Gordon.
Thank you, Madam Chairman. I believe it's on page 87 in our packet. There is a budget line 0622.0005 vaccine/prescription/non-prescription. I don't have any questions about those numbers. I am wondering how those numbers might be affected by the identification and beginning distribution of a possible COVID vaccine, something I know we're all looking forward to. I'm just wondering what the impact of a COVID vaccine might be on those numbers, and both in terms of revenue and expenses.
I think
your best estimate.
a lot of it will depend, I think, maybe even on the payment for the vaccine. So if it's provided to us, or, if I don't, I can't really speculate of whether we'll have to purchase it, but we may not have to purchase the vaccine, and we know for a fact that there will be certain supplies that will be given to us from the feds to the state. So I don't really know exactly how to anticipate the costs of this yet.
Are there various brainstorming scenarios that you have had 30 seconds to give your attention to, given everything else you're involved with?
Yes. Yeah, we've been focusing on mass vaccination for almost a month now, just knowing that there's multiple scenarios. So there's multiple vaccines and not knowing when, what type it's going to be, what's the storage. There's a lot of different scenarios that we're running through, and knowing it's also going to be possibly January, winter, and we need to social distance. That's another thing to keep thinking about too, is how do we get that?
Yeah. Well, I know there are variables by the dozens, if not more. And I'm sure you understood that I wasn't asking for a specific response, because there cannot possibly be one right at this point. But in terms of the county board's fiscal responsibility, and yours, of course, we have to be thinking in the directions that some of the needs might exceed what even some of our most pessimistic projections might work out to. So I hope we can be optimistic and keep it within reasonable bounds, while we're doing, of course, what we want to see done, and that is to get a lot of the population vaccinated so that we can move past the pandemic finally. Thank you very much.
And look to, I think, H1N1 as an example of what was done. So we've definitely been pulling that back out and looking at what we did then.
Any other questions on that one? That is actually the fund that is to be self-supporting, that gets no funding. Then we'll move on to 0061011 TB care and treatment. Any questions regarding this fund? If not, I think we're going to be ready to vote. So, Ms. Morlock, would you please call the roll?
Okay. Member Gordon,
Yes.
Member Chung,
Yes.
Member Went,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes.
Carries.
Okay, motion passes. So the health department budget will move forward with some of those adjustments that we've made. Ms. Rodriguez, we're back to you.
Thank you, Chairman Schaefer. I would turn the committee's attention to item 2A, actually D2A, which is our report on recent employment activities on page 93. I'd be happy to answer any questions.
Are there any questions for the county administrator? Okay. Next, we have any other business or communication? We have a special budget meeting we will cover the nursing home, I believe, and jail and JDC medical on October 21st at 4:30. Is there any other business or communication for the committee? If not, we have bills to pay and they have been reviewed and they comply with all of our ordinances, resolutions, or policies. First one is the nursing home has a prepaid total of $213,909.86. Motion by Gordon, second by Chung. All in favor? Oh, wait a minute, can't do that. Ms. Morlock, sorry.
You need to unmute Ms. Morlock.
Sorry. I'm usually in person. I'm sorry. Member Gordon.
Yes.
Thank you. Member Chung,
Yes.
Member Went,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. That passes. Next is jail and JDC medical with a prepaid total of $49,917.96. Motion by Chung, second by Gordon. All in, Ms. Morlock.
Member Gordon,
Yes.
Member Chung,
Yes.
Member Went,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. That one passes, and the Developmental Disabilities Board has a prepaid total of $304.43. Motion by Chung. Second by Metzger. Ms. Morlock.
Member Gordon,
Yes.
Member Chung,
Yes.
Member Went,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. Are you still there, Julie?
I am. Are you not hearing me?
Yeah, there was just kind of a really funny echo, that's why.
Okay.
Okay. So that one passes, and the Board of Health has a prepaid total of $312,645.98. Motion by Metzger, second by Gordon. Ms. Morlock.
Member Gordon,
Yes.
Member Chung,
Yes.
Member Went,
Yes.
Member Metzger,
Yes.
Chairman Schaefer.
Yes. Thank you. And since there's no other business, I believe we're going to adjourn this meeting. Thank you all very much.